Ready to go, Joe?
Ready to go.
Good afternoon. I'm Reverend Mansfield Caseman, best known as Casey, serving as the Interfaith Community Liaison in the Office of Community Partnerships, and I'll be moderating today's town hall on reopening houses of worship. Our Faith Community Advisory Council is pleased to be hosting this session with our partners in the Office of Emergency Management and Homeland Security. Our purpose is to bring the decision makers together with the faith leaders for a better understanding what lies behind the executive order and what it means in practice, and how we as public officials and faith leaders may keep our people healthy and as happy as possible. Joe Corona, the outreach coordinator for the Office of Emergency Management, is at the controls and will now show us the agenda. Note that it is full because we wanted faith leaders to know the key public officials responsible for the decisions impacting all of us. The questions many of you have been raising over the past number of weeks have been sent in advance to those addressing us today. We are sure other questions will emerge, and I ask you to write them in the chat box for two reasons. One, Joe, with the assistance of Yasmin Elazar, the program manager for our Faith Community Advisory Council, will be reading the questions and identifying those not already answered. Two, we will be reviewing all of the questions, some of which we may not have time to answer. And we may also have speakers agreeing that there'd perhaps be some more material that could be available with a little more research. All of that will be brought together then and sent to everyone who registers, which you can do again by giving us your name and your email address, and indicate as well if you're not receiving our newsletter and would want to indicate that too, please. Has our county executive been able to join us at this point? And if not, let me then go ahead and introduce Jim McClellan, Management Specialist in the Office of Emergency Management and Homeland Security, who will now present the highlights from the executive order pertaining to houses of worship. And those should be appearing on our screens now.
Well, hi, my name is Jim McClelland, and as Casey mentioned, I work in the Montgomery County Office of Emergency Management and Homeland Security. I'm in the planning section. And first of all, I'm thrilled that we have this opportunity to meet with you. The faith community is extremely important to us in Montgomery County. It's one of our greatest resources, to be honest. And I have been involved in the past. I've done a number of, I've been a co-presenter in a number of presentations on how to protect our houses of worship against violent attacks. And now we find ourselves with a new risk that we need to be able to protect ourselves against and keep our congregants safe from, and that's coronavirus, something I never thought would be dealing with at this time, but here we are. So there is an executive order that came out with an effective date of June 19th, 2020. It's the first link, or I'm sorry, the second link on the page that you see there right now. And this talks about the various impacts of phase 2 of the county's reopening, including houses of worship. There has been some confusion about what that exactly means for houses of worship. It's a 9-page document, and sometimes that can be a little difficult to navigate. So I want to just walk us through the points that apply specifically to houses of worship so we can understand what the impacts are. So next slide, please. Joe? Okay. So there are really three paragraphs of the executive order that I need to be aware of. Paragraph 3 talks about general opening and operating requirements for all businesses, government offices, and other entities, including houses of worship. And this requires that we maintain social distancing of at least 6 feet between individuals, that we have the use of signage and markings to guide people so that we minimize the chances of getting closer than the 6 feet. The use of face coverings, making sure that employees have guidance and training, and then the different protocols for disinfecting various areas and surfaces, employee hand washing, things like that. These apply across the board, but there is no mention of a maximum number of individuals that can be in a particular space. So if we can go to the next slide. Okay, so paragraph 4 talks about indoor and outdoor gatherings. But this really applies to indoor and outdoor social, community, recreational, leisure, and sports gatherings, and does not mention religious gatherings. So this is more like movie theaters, sporting events, things like that, where you might have a large number of people gathering. This one does specify a maximum of 50 people and 1 person or household per 200 square feet, whichever is lower. Again, this does not apply to religious facilities or houses of worship. So we can go to the next slide. So if you skip all the way through to paragraph 18, this addresses religious facilities. It applies to both indoor and outdoor gatherings. You must comply with general opening requirements, which again has to do with maintaining social distancing, disinfecting surfaces, having face coverings. Now, this one specifies 1 person or household per 200 square feet of religious ceremony space. There is no mention of a maximum number of people that can be present at any time. So really the limiting factor is the size of your religious ceremony space. And if you sort of picture a grid of 200 square feet is roughly 17 by 17 feet. So imagine a grid in your religious ceremony space of 17 by 17 foot squares. Those are the areas that can be occupied by 1 person or house. So if you have a very large facility, you're going to have a lot more of those squares. The other thing to be aware of is if you have multiple ceremony spaces that are distinct and separate from each other, they can be within the same building, but if they are distinct and separate from each other, again, the 200 square foot rule applies to those too. So I know there's been a lot of concern, people thinking that there's a maximum of 50 people. There really isn't. It's governed, or it's governed by the size of your facility. So I hope that adds a little more clarity on the number of individuals that can be within your facility when you resume your gatherings. And so I know there may still be questions. Please submit them through the chat, we'll cover as many of the questions as we can at the end of this. But at this point, I would like to turn it over to Dr. James Bridgers, who is Deputy Health Officer for Montgomery County.
Hi, good afternoon all. Actually, Dr. Rogers is going to give the public health update. I'm going to support him with some additional expanded testing that we would like the faith-based community to support us in. You know, we've been about 3 months or 110 days into responding to COVID-19 in Montgomery County, but who's counting? And so we're looking at additional strategies to not only, as it began, addressing those individuals who presented COVID or who had COVID-19 symptoms, but those individuals, as we learned, were asymptomatic without any visible symptoms and were transmitting or spreading the disease in the community. The Health and Human Services and Public Health Services has expanded our capability to not only test through the original nasopharyngeal swabs, which we got from the Governor, Maryland Department of Health. We had 34 during the second week, to ramping up to 10,000 plus kits a week. And so we would like to partner with the faith-based community, but I'm going to stop there and let Dr. Rogers provide an update, and then just return and share some of those strategies with the audience this afternoon, and ask for your additional support. I also provided a link in the chat room. We're having a testing event, a pop-up testing event in Tacoma Park on Thursday from 10 to 2 p.m., which is free testing for all. There is a registration link provided, so we ask that all pre-register. However, we have the capability to accept walk-ups for the testing. So I'm going to pause now and let Dr. Rogers give the audience an update and share a few public health announcements. And then I will return and talk a little bit more about our testing capabilities and what that test entails.
Good evening, everyone. It's good to be with the Faith Community Advisory Council, faith leaders, and public health officials to discuss information and preparation to safely open our houses of worship and lower the chance of staff and congregants getting sick. Before providing some public health recommendations for houses of worship, just briefly touch on some COVID-19 statistics in the state of Maryland and in Montgomery County as of 10 a.m. today, June 23rd. The number of new confirmed cases and the number of new COVID-19 related deaths is declining across the state and in Montgomery County. The number of confirmed cases in the state currently stands at 65,007. The number of confirmed cases in Montgomery County, 14,204. The number of confirmed deaths in Montgomery County is 685. The number of tests administered in the county is rising. The 3-day average of the number of tests administered in Montgomery County currently stands at 1,485. Minorities across the state and in Montgomery County continue to have the highest case rates and deaths, with African Americans being disproportionately affected. Lastly, the top 3 zip codes in Montgomery County with the highest prevalence of COVID-19 are 20906, 20902, and 20904. Some other public health recommendations for houses of worship include virtual services, followed by drive-in and outdoor services are highly recommended in lieu of indoor services as the best way to prevent COVID-19 from spreading among congregants. If your organization is planning to resume indoor services, it is recommended that you use an online platform to allow people to sign up to attend service, have more than one service to allow for limited in-person congregants, but still permitting congregants to participate in person, or assigning services according to last names or some other system. For indoor services, consider holding services in a large, well-ventilated area. Sanitize hands upon entering and exiting the worship center, and consider propping open entry and exit doors before and after services, or have dedicated ushers with face coverings to hold doors open in order to limit touching of doors and doorknobs. Consider whether physical contact such as shaking hands, hugging, or kissing can be limited among members of the faith community. Take steps to minimize community sharing of worship materials and other items. For example, modify methods to receive financial contributions. Consider using a stationary collection box or electronic methods of collection instead of shared collection trays or baskets. If food is offered, consider pre-packaged options. Limit sharing of objects such as worship aids, prayer rugs, hymnals, and other bulletins or books. And if possible, photocopying or projecting prayers, songs, and text using electronic means. Consider limiting the use of choirs and congregational singing in order to minimize the spreading of droplets. For receiving communion, instead of sharing distribution trays, consider the minister being located in proximity to allow for congregants to form a line from the minister, ensuring 6 feet from others, receiving disposable sacraments from the minister, then stepping 6 feet away from the minister, then carefully loosening your facial covering, consuming the sacrament, and replacing the facial covering. Before and after consuming the sacrament, ministers and congregants should disinfect hands with at least 60% alcohol. Finally, at dismissal, consider having the congregation dismissed by rolls under supervision of an usher, and consider avoiding the pastor, imam, and other ministerial staff from greeting congregants as they leave the service to avoid crowding at the exits of the church, mosque, etc., and promoting social distancing, rather the final blessing taking place from the lectern. Now I will turn it back over to Dr. Bridges, Montgomery County's Deputy Health Officer, who will discuss countywide efforts to expand testing.
Thank you, Dr. Rogers. Dr. Rogers covered a lot as far as a public health perspective. A lot of the guidance and information that Dr. Rogers shared with you has been guided by the Centers for Disease Control and Prevention policy that they have for faith-based community. We've also looked at the surrounding jurisdictions, Northern Virginia, Prince George's County, and Washington, D.C., and analyze what their guidance is, which is somewhat similar to us. Each community is different. But the primary goal and purpose of establishing all of the set policies that Jim mentioned and Dr. Rogers mentioned is to stem the transmission of the pandemic. We got word this morning that Dr. Anthony Fauci indicated that a vaccine is coming soon. I saw in the chat box, was it the notion or the guidance by Governor Hogan to fully open once we have a vaccine? I haven't seen that. I know that he's categorized the stages into low risk, medium risk, and high risk. And those high risk areas, as we've seen nationally and locally, have been those events of large gatherings. And so as we look at large gatherings and we think about recovering and reopening through a phased approach, we want to keep in mind consistently practicing safe social distancing, washing our hands frequently and often, looking at our younger children and our elderly folks who may not be able to practice such safe hygiene, but encouraging to do so and assisting them where possible. And then we moved from stay at home to safer at home and limiting those community activities, or even sharing those community activities where there are large gatherings, because the science and data has shown that there's limited transmission in those settings. And so what we've done over the course of these 3 months, plus months, I should say, is look at increasing our capacity to get Montgomery County residents and citizens tested. So we have a procedure, which I mentioned before, which is the nasal pharyngeal swab, which you see, which is the Q-tip inserted in your nostril to collect the sample. But we also have the capability now to have minimal requirements as far as testing capabilities for individuals to self-administer a high throughput oral testing kit. There are two types. One is by an oral swab, and one is by producing a sputum. And so we can collect these kits and have a result response in 24 to 48 hours, with the notion of identifying those individuals who may test positive for COVID-19, identifying those networks through our contact tracing, and then getting those individuals isolated and out of the community to stem and lessen the spread of the transmission. And so, as indicated earlier, we have a for our community testing track. We have 3 tracks currently scheduled and planned thus far. We have a clinical track where we are supporting and providing test kits and assistance to assisted living facilities, congregate living spaces, group homes, and long-term care facilities who otherwise did not receive testing support from the state of Maryland. We're also supporting hospitals who also want to increase their staff. They're testing their patients, but their staff often go without a test, and we're providing, the county is providing this capability to support them as well. And then the community track is which I want to solicit your input and support, is to help us as we restore the county to its full capacity and you return to your maximum support to the community through the various spaces and faiths of worship, is to help with conducting pop-ups or test sites at your various institutions. And that works in a way where we have a site coordinated work with someone who you designate, and to have any set number of individuals to be tested based on, it's solely volunteer. And if, for example, you're having a worship service and you want to have a scheduled event, we can work with individuals from your organization to schedule a testing after services, or sometime depending upon the time of the service, before service. It could be a limited number, it could be a larger number. A larger number would require more support, and we will have a site coordinator help test your congregation or congregants or worshipers who may be interested in knowing their status. It's free. It's not as invasive as a nasopharyngeal swab. And we're looking to expand our capability, in the community. Dr. Rogers noted those highly impacted zip codes, and we're interested if your faith-based institution is located in one of those zip codes. We would love to follow up after the town hall and schedule a meeting to discuss our.
Excuse me, Dr. Rogers.
Yes.
I'm sorry to interrupt, but I believe
County Executive Board.
Belrich may be on the
Okay,
on
that's
the line,
fine.
so I want to give
That's
him
fine.
a chance.
I will yield to the county executive, but we are really enthusiastic about supporting and getting the faith-based community.
Yeah, we'll get back to that. We'll be coordinating that with you.
Yes.
Let me just quickly say that we're very privileged, of course, to have our county executive, Mark Elrich, with us because he's facing the twin viruses of COVID-19 and racism and providing exemplary leadership. I know his time is very restricted. So without further ado, Mark, we look forward to your remarks.
Yeah, I'm going to be brief. I was actually listening since about 4:08, so I've gotten to hear the presentations. I didn't see any point in breaking into it because I think the most important information is the information that everybody else has, not so much what I have. I just wanted to thank everybody for joining into this today, and it's really important. We're trying to reopen the county as safely as we possibly can. And when we think about reopening the county, we think about all aspects of the county. My focus has been pretty much solely on making sure people are safe and we drive down the number of infections as quickly as we possibly can, so that life could be as normal as it possibly can. I'm not expecting normal to come back anytime soon. I'm pretty much anticipating that going forward, it's very likely people will be wearing face coverings for a long time. And they were likely to be experiencing physical distancing for a long time. Until we're certain that the virus is gone from here, we have to be extraordinarily difficult because we know the people who spread it are the people we don't know. That's been the real danger in this all along, has been the continued problem with not being able to identify who's sick until they're too sick, or until they've gotten to the point that they're spreading the virus and not knowing that they're spreading the virus. So I'm very cognizant of that. I have relied heavily on my public health advisor, Dr. Gales. I have refrained from inserting my opinions or my wants into the decision-making process because I do not want to be that man on TV who makes an announcement with his health officer either having to cover his face or rolling their eyes. And so I'm trying to make sure that what we do is in line with the best medical advice that we can possibly give people. I'm glad we're in phase 2. We're going to continue, if our numbers continue to go down, to look at further loosenings of some of these regulations. We're not there yet, but a couple of weeks ago, we were averaging close to 200 cases a day. Now we're a lot closer to 50 or 60 cases a day. That's a big change. If this week holds up, we'll have 2 weeks of better numbers. We're still not where we want to be. I know Dr. Gales would like us to see under 20. Getting under 50 will be somewhat of a milestone for us. But we think, we're making progress in that direction. And I'm optimistic that that we'll get there because amazingly, most county residents seem to be following the directives. When I go out and I see people wearing masks, people seem generally to be abiding by all the protections that we've been asking people to abide by. And I think that's the reason we've been as successful as we've been in this county. And I'm hoping that people maintain their patience and get us through this the rest of the way. I'm as, displaced by this as everybody else is. My life is not my normal life. I'm not able to do any of the things that I would like to go do because I can't afford to put myself or others at risk. And I just hope everybody understands that. I know it's hard. I know it's not fun. And I know we'll be really happy when things are lifted more, but be patient with us. And if everybody keeps doing what they've done, that's how we got to this point. And if we keep doing it, that's how we'll get to the point where we're more free from this than we are right now. But the direction is good. And hopefully you all will be able to make accommodations, continue to make accommodations during this interim period. And as things do improve, then you'll need to do fewer accommodations for this. So I'll stop there. I've got to get on to another meeting today. I came from one, that's why I was a little bit late, and I'm about to go into another one. And I do like the miracle of Zoom or Microsoft Teams or whatever platform I'm using right now, because it really does enable people to get together and meet in ways we would have found very difficult otherwise. So unless somebody has a quick question or so, I will be going to the next thing. But thank you.
Thank you very much, Mr. County Executive. Let me just say that one of the primary reasons for doing this is to be preparing our faith leaders with more information and motivation to be doing just what you're doing right now, which is to encourage all of our citizens to be understanding and patient, so that together we can maintain public safety and keep people as happy as possible.
That's a caveat for sure.
So appreciate your time. I think before opening up to Q&A, we should move on to some brief remarks from another close partner in all of this, Ron Maxon, who is the Core Service Manager for the Community Use of Public Facilities. Is here to talk. Yes.
Before we go any further, I believe Council President Katz is also on the line right now.
Well, he was to come later on the agenda, but do we?
Okay, I
is that
just wanted
possible?
to, out of respect for his time, see if he wanted to speak now.
All right.
Well, thank you very, very much. And Councilmember Friedson is on this call as well. I see him. I don't know.
All right.
I don't know if we have others or not. Mark was saying that he was Zooming from meeting to meeting. Well, we just Zoomed from our council meeting to this meeting. So it's one of those lovely days. It's amazing. I knew what Zoom was before, but I never lived Zoom before. We all do. We all go from Zoom to Zoom. But thank you all very, very much for everything that you do for Montgomery County. Mark certainly said it, and I just want to repeat it. I know that we are going through some of the roughest times. I'm from Montgomery County. I was born here, and as was my mother, and I know that we have never gone through times like we're going through right now. I've never seen anything like this. As I tell people, how much worse could it be than murder and sickness? And that's what we're going through. And if we've always needed the faith community, but we certainly need them even more than we've ever needed each of you before. Montgomery County is a blessed place. It truly is. But we have problems just like others, perhaps not as deep as others, but we have problems just like others. And we need to continue to work together to figure out what's the best way to see the light, literally. But I appreciate everything you're doing. We are working towards Mark and Dr. Travis Gales, the public health officer, are working towards getting people back to whatever normal will be. It won't be exactly the way it was before, but it is what we know it will be, something similar to or better than what we have now, and something similar to what people would feel comfortable doing. We appreciate everything that you are doing for the people of Montgomery County. And with that, I'm going to stop. If you have questions, please let me know. But I do also have another Zoom, so I won't be able to stay the entire time. Thanks.
Thank you, County Council President. Yes, we're asking people to record their questions. We're eager to get on to those, which we can do following the remarks of one of our close partners. If those of us with houses of worship think we're dealing with serious concerns, those that are dependent upon the use of public facilities are facing even more difficult times. And so I wanted Ron Maxson, the core services manager, to address how that's being handled today.
Thank you, Casey. It's great to be here with you all. We, as Community Use of Public Facilities, are very grateful to have been a long-term partner with the Faith Community Work Group, especially that on land use and other issues over the last several years. We appreciate all the hard work that goes into that committee and that work group does to keep our faith communities very informed and up to date on religious land use matters and a plethora of other things that go on throughout that work. It continues to be an excellent partnership. During the pandemic, obviously public space has become not available to the faith community as well as to all community users. We have 6,000 community user groups that use our 17,000 spaces that are available to the community at large. And so they have been closed for the most part. And we're working with the Montgomery County Public Schools leadership to hopefully in the next phase or so see what we can resume as far as housing the public worship timeframes in schools and other public buildings. We will continue to work with our partners in that. And we look forward to continuing and growing the collaborative relationship that we have with the faith communities that have brick and mortar facilities currently, because perhaps maybe we can continue as we have over the years to allow some of the smaller groups that are using public facilities to maybe use some of the brick and mortar buildings that already exist in the faith community. And so that's an option that we have worked with a number of times over the years during construction projects and things of that nature. And hopefully we'll be able to not only continue that, but enhance that. I would like to introduce to you, if she's on the line, our Director of the Office of Community Use of Public Facilities, Ramona Bell Pearson. Are you on the line with us?
I am. Thanks, Ron.
Yeah.
As Ron stated, we are trying really hard, especially those houses of worship that don't have brick and mortar establishments. We're trying to come up with creative ways for community use that is specifically relevant to houses of worship. We aren't there yet, but we are working towards that, and we hope that as more phases open up, that there'll be more opportunities. So we very much want to support what you're doing, which obviously supports our community. These catastrophic times are very trying on people, and one of the main things you need is your religion. If you believe, it's a very great source of support. So I just wanted to echo what Ron had said, and thank you for your partnership.
Ramona, we so appreciate you making yourself present with your precious time this afternoon, and we'll continue to work very closely with you through Ron and your team. All the faith leaders online can expect in subsequent newsletters to be hearing about how we can be working more closely together to help those that are needing space to continue. Some of these communities, by the way, do not have the same technical expertise that we take for granted. Several, in fact, don't have computers. So our Religious Land Use Working Group now has made 2 rounds of calling on all of them to see how we can be more supportive to them. That report will be coming back to us tomorrow. So thank you. We're now at the most important phase of our town hall, the Q&A. And so I'd encourage everybody, if you don't already have your questions in, to put those in now.
And Casey?
Yes?
I know I had cut in on Dr. Bridger's portion. I wanted to make sure if there's anything else that he wanted to present and continue before we go into that. I kind of cut him short there.
Sure, Jim. Thank you for that. Just a couple of things I saw. Our staff has posted information about the town hall. Mr. Ken Hartman has also posted information. we have data available, the link to our daily data dashboard that we have on the county website, as well as at the Health and Human Services website. One of the questions in the chat room that I know that asked was about the oral swab and the sensitivity and specificity of that. Both have been vetted through the Maryland Department of Health, and the vendor whom we received the oral kits from have requested and received an emergency use authorization where the sensitivity is 95% or better and the specificity is 90% or better. So that has been approved. The other question is, I think, regarding monitoring data. We provide an update to the county council twice a week to just look at those data trends and analysis. I know that the county executive also monitors the data trends. So we are proactively monitoring any spikes in the county, looking at those areas that have higher cases and looking, developing strategies that proactively work to reduce not only those high impact zip codes, but address many challenges that individuals may or may not have in that community, in addition, which is part of the Health and Human Services integration that's now being included as part of our testing activities. So if individuals who may have been, for example, providing providing food distributions at various faith-based institutions, we are looking to partner with them to increase that capacity to not only support those human service needs, but also testing as well. And so I will stop there, and I think it's time for Q&A.
Let me add that in addition to having a PhD in health science, Dr. Rogers is an ordained Baptist minister, and Dr. Bridgers is close. He hopes that in addition to everything else he's doing now in dealing with this crisis, that he can complete his theological studies this summer, making both of them all the more efficient in working very closely with our faith leaders. So with that, let's open it up then to the first question.
Yeah, Casey, can you hear me?
Yes.
Okay, so there are questions about testing and cases of COVID, but I think people want to prioritize on the issue of square footage. So we have our first question here. How was the 200 square foot number derived? If you look early in the thread, there were a number of questions on that. 14 by 14 feet makes no sense. That is about 12 feet between individuals. Should be 7 by 7 or 8 by 8 to have 6 feet between people, which is 50 to 65 square foot. Who would like to take that question, please?
I can take a stab at it, and Dr. Bridgers or Rogers would like to step in. I certainly welcome it. I think the smaller blocks would make sense if it was only one person within that space. But since it is per family unit, they, have 10 people in a family unit that are within that space. And so that sort of narrows that gap between them and other congregants. So I'm not sure what the formula was that was used for coming up with that, and if either of my public health colleagues would like to address that.
Sure, Jim. We had some discussion with this same challenge, and it is interpretive guidance based on the governor's rule. The governor's rule for phase 2 of his roadmap to recovery had a limited size capacity at 50. And as we looked at the other surrounding jurisdictions, which looked at a percentage of the space and or the number of participants, I know that Dr. Stoddard and other members from his team worked with the county fire code to look at space configurations. We also looked at a linear kind of square footage calculation versus a circular square foot calculation to try to provide maximum space as far as safe distancing. I know that in the chat box, individual participants this afternoon have calculated that, but for larger spaces and individuals who are supporting any worship service, the notion is to try to have at least 6 feet in that particular space, so that we could allow a gathering that was not only safe, but participatory, if you will. And so that was the configuration that we used. It will vary, and we tried not to have a cap because we had questions come in. If I have multiple rooms, worship rooms in my particular building, could we have individuals, could we have 50 in here and 20 in another? And it's still based on that square footage maximum allowable for both indoor and outdoor. And so that was the rationale and the strategy, keeping in mind, again, the safe distancing and the space configuration. The other piece was with the ventilation and the transmission. I think a question came up in the chat box as far as singing. Well, the virus is transmitted by droplets, oral droplets, and if you have a face cover on, then that prevents the spread of the transmission from coughing or sneezing or talking. And so in those instances, we took that into consideration as well. We've seen spikes in the community from individuals who have participated in protests, and we have repeatedly encouraged individuals to wear face covers because they have helped to stem the transmission of the virus. And so all of these public health considerations based on guidance at the federal and state level, we took into consideration that would speak to our community, Montgomery County faith-based institution, but also allow worshipers to be able to participate in a service that's not virtual.
I agree with you, Yasmin, that the primary concern that we've been hearing about over the weeks has to do with confusion with regard to that formula. So I'm wondering if there's any way of indicating, either by people raising hands or by the other questions you may be looking at that I don't see myself, whether or not anybody want to raise another question just for further clarification.
Yes, I do. I'm George Sims. And I just had a question about what you just said about singing. And I'm just wondering about the safety of singing with a face covering on. Do you say that is recommended, that's not recommended, or it's adequate or not adequate?
Sure, George, thank you for that question. We discourage any talking or speaking or non-face covered in close proximity or close spaces where there aren't social distancing. And so if an individual can wear a face cover in a social setting, that's the preferred. We definitely discourage not wearing a face cover or a face mask in a large congregate setting.
But it sounds like that's not required. I think the question had to do with whether or not you'd be requiring vocalists and speakers to wear a mask.
Sure, I'm going to suggest that it's required. I would have to get a definitive answer by going back, but from all of the literature and the information that I've read, we want to have face covering. So for example, let me give you a prime example. Dr. Rogers.
So you're wanting, that's the question that keeps coming up.
Yes,
People want to know what is, in the executive, what's in the executive order. That's what they're trying to
Sure.
interpret, and they want to understand where you come down on it.
sure. It's strongly recommended is the bottom line that they wear a face covering.
Right.
They're singing.
Thank you.
And
Good.
the executive order does not specifically address singing in religious gatherings or anything, or the wearing of face coverings while you're singing. It just requires the wearing of face coverings, period. So,
Correct.
So that's really left up to the discretion then of our faith communities, but at the same time, what we're underlining is the importance of safety. And so then the recommendation that these face coverings be used might want to be, a guideline or requirement for people entering our houses of worship.
So Casey, this is Ken Hartman.
Yeah.
So the face covering is a requirement of the state of Maryland, of the governor in indoor gatherings. I can post the governor's order in the chat. It's the one that also has to do with social distancing. And I believe the county, as of last week, has a similar order that follows the governor's order.
And isn't that part of the fact sheet, Ken, that you sent that I had included in the call to this meeting?
It is.
That's right. So if people would look under the houses of worship fact sheet, that could be very helpful to you.
I have a question regarding that, because I've looked at the fact sheet and it says that everyone 2 and older is required to wear a face mask in accordance with the governor's guidance. But the governor's guidance says that children 2 to 9, adults will use reasonable efforts to cause them to wear a face mask. And with it, having raised a 2, a 3, and a 4-year-old, reasonable effort doesn't mean they will.
So,
all of us understand that, I think.
Sure.
Thank you.
Sure, and that was Dr. Gale's. That was Dr. Gale's interpretation based on having it for 2 and older, and so that's when, as I referenced earlier, there's some elderly individuals who may not keep their face mask or cover on, and we ask that you help those children, those young children, keep their mask on as well. So that was a directive by Dr. Gales.
But is it a
Thank you.
requirement or a desirement?
Based on my understanding, it is a requirement.
Thank you.
Next question.
I threw a question out earlier that Scott went at with the Rockville United Church. I think it's relevant at this point in the conversation, and that's regarding whether we could come together as a county and potentially have some training for chaperones who would then be in our congregations for every small gathering, that are politely prepared to say, put your mask back on, social distance. I mean, I'm using the word chaperone, echoing back to good old high school proms, but that have the courage and the kindness to be able to help us out whenever we do open up. Thank you.
Good idea. Next.
I'm trying to ask a question, but I'm still muted.
You're on.
Okay, this is Reverend Jane Wood. I'm the interim pastor at St. Paul Cherry Chase. And the CDC guidelines indicate that even with a mask, you should not be singing. So why are you saying that it's okay to sing?
Reverend Wood, you are correct. My guidance is based on what I read at the CDC as well, and we posted that as far as singing. Actually, they are requesting that there's limited talking and or socializing in the church. If an individual can sing, it is only a recommendation. It is not. Yeah, and it's limited as Dr. Rogers just reported it to me. So it's interpretation of the guidance from CDC. And so if you feel strongly that individuals should not sing, then I would go with your guidance to your congregation. But again, its interpretation is based on the interaction and based on the science that we're seeing, where we know that the virus is transmitted orally. And so we want to have those safeguards and those precautions in place.
Thank you.
This is Meyer Karp with Son of David Congregation in Durwood, Maryland. How are you? I have this question. If the safety of the citizens of Montgomery County is the main concern, why the discrepancy, as someone asked on the chat room, between 50% occupancy limitations for restaurants, yet houses of worship can only have one person or family for 200 square feet? That seems to me to be discriminatory.
I can speak to that, at least from an opinion, is we should compare churches to similar types of gatherings, or houses of worship to similar types of gatherings, where you've got a large number of people who are gathered together at, at the same time. With a restaurant, you've got flow in and out. With a store, there's a constant flow of patrons going in and out, where houses of worship are more like, as I said earlier, more like movie theaters or sporting events where people are gathered in one spot for an extended period of time. And we've actually, the requirements for houses of worship are less restrictive than they are for other similar gatherings. Those do have a cap of 50 people plus the 200 square foot requirement, where houses of worship do not set that maximum number of people.
Thank you. Another question?
Yasmin, you can take some questions from the chat box.
Another question, please.
Okay, I know it was addressed earlier, but there are several people asking clarification with the difference between outdoor and indoor distancing.
The executive order does not set a distinction between indoor and outdoor gatherings for religious facilities. It's the same 200 square foot rule with no maximum number. And Drs. Bridgers or Rogers, would you agree with that?
Any comment from Dr. Rogers or Dr. Bridgers? I gather
Hi,
not.
Reverend Casement. We were muted. So again, it's the same principle that we've looked at before, that Jim talked about, the spacing. That's the guidance and interpretation that we've used as far as the space configuration. And until Dr. Gales or Dr. Stoddard changes that, that's the space configuration that we are being held accountable to.
Mm-hmm. Thank you. Are there any other questions that haven't been raised in the chat box, Yasmin?
Okay, I'm sorry, I have the host is late in unmuting me, but there's a question about can a worshiper by Montgomery County law sue the church or a mosque for contracting COVID-19?
It's a good question.
Hi, that's a great question. I would have to seek legal counsel for that. We've had we haven't received a question of that magnitude regarding as far as the guidance that we're given. So I've noted that question, and we can follow up with that accordingly.
Friends, you might also reach out to your policyholder for your own institution and see what their guidance is.
Excellent point. Thank you.
Okay, there's a question about.
We'll follow up on that. That'll be included in what we send out in a few more days. Yes, Bean?
Yes. What about other functions like funerals? Are they allowed within the restrictions and guidelines?
From my interpretation, that is still a religious gathering, and I believe the restrictions would apply there.
And Jim, Dr. Rogers are in agreement that those same principles and guidelines would attend to funerals or any other services. One of the examples that I shared with Reverend Caseman was I had a friend who received the sacrament of marriage, and the individuals were socially distanced. This was during phase one. They were not in the church. They were outside the church, and they were standing on the steps of the church, socially distanced. The pastor or the clergyman was 6 feet away from them. The individuals, no more than 10, were gathered outside. And so, keeping with the same guidelines that would apply to all of the services based on our understanding and interpretation during phase one and phase two.
Okay. A few people are asking about specific cleaning and disinfecting instructions.
Sure. I don't have the CDC guidelines before me, but I know when I looked at it a couple of days ago, it's still the frequency and the number of individuals. So especially those high contact areas such as doors, pews, bathroom handles. If bathrooms are accessible, you want to clean them as often as possible. I think the guidance is every 1 to 2 hours, but certainly if you have more services, you want to clean them before the services and immediately after the service. I liked the question that Mr. Winnett said as far as having a chaperone or a guidance. That individual or individuals could help facilitate some of those cleaning reminders. And as far as, in addition to wearing face coverings and masks, etc. So as frequently as possible, I have a staff member who can quickly research that and post it in the chat room as far as the frequency.
And actually, just reading from the operating requirements that are in the executive order, one of the things is use CDC and Environmental Protection Agency approved disinfectants to clean spaces daily, including disinfectants to wipe down surfaces, high contact surfaces, or wipe down high contact surfaces at least once every 2 hours while staff or customers are present. It says high contact surfaces are surfaces that have human contact at least once an hour.
And also, if your church is larger and you're offering multiple services, of course you want to give the proper amount of time so that you can disinfect the church worship area appropriately. So
I'm pleased to report
someone asked the question, there's not a required time period between services in the same space. You want to give yourself enough time in order to disinfect the areas throughout the church.
And I would add to that, I know at the church that I attend, in between services, the lobby area can become very crowded as one service is leaving and the next one coming in. So you may need to have a greater period of time between services to allow the first people to leave before the second ones come in. Unfortunately, this is going to require a lot of changes in how we do things for the foreseeable future. So a lot to consider there.
So, and I just saw another chat. So the question before was, is there required time in between services? And I saw someone post something about a guidance. We want to differentiate between required versus guidance. While the guidance may take into consideration a certain amount of hours, there's no required time in between the services in which you can, allow another service to take place. Make sure you give yourself enough time to do those disinfecting procedures according to CDC guidelines.
And another variable, just to add on to this, in some of our houses of worship, people are needing to come into smaller spaces for taking off their shoes, for instance. And in those instances, it's going to require even more time and more thought being given for the safety of their members.
And I think it depends also to a great extent on the size of the facility, because, for example, a mega church that normally seats 2,500 people, it takes a lot longer to vacate from the first service before the second one comes in, where a smaller house of worship that has 50 people per service takes a lot less time to do that transition. So I think that's one reason why we don't want to come up with there must be this amount of time between services. It's something that you'll have to determine based on your particular house of worship.
And it can be very helpful requiring reservations with regardless to the size of your sanctuary. With reservations, then you have a sure way of controlling it and having people happy instead of upset that they finally came to worship and it was either too crowded or they were just turned away. It's also my observation that people in the main now have become sufficiently proficient when it comes to the use of technology and all the materials that are out there virtually in terms of music and art and poetry and more, that people are more content now. They're being given a sense of community even while doing it virtually. And many are saying that they're in no hurry to return. In fact, many now are not planning for anything back in their sanctuaries until we're well into the fall. Other questions or comments?
Yes, please address who will be enforcing these guidelines.
Sure, thank you. Great question. I will respond. The individual should contact 311, who will then in turn notify Public Health Services, Licensure and Regulatory Service branch, who will work with Montgomery County Police if necessary to enforce and levy any penalties associated with non-compliance. Ms. Alasia, there was another question in the chat box regarding how can we set up a testing event. Individuals can contact 240-777-1755, which is our call center, and individuals in our call center will fill the request and respond and schedule a follow-up call to set up testing and to identify the specific needs, area, and or location of testing, because we want to make sure that our testing capabilities are compliant with the executive order and the public health mandates.
I'd also be concerned, we can talk about that offline, that we're not raising people's expectations. In other words, if there are ample testing kits finally available, then I'd want to include that in our next newsletter. And I can assure you there'd be multiple faith communities wanting this to be at their next service, or otherwise it'd be arranging it not at the service. More than likely it would be in their parking lots or facilities where it could be handled safely.
Yes, thank you for that.
So we'll
Absolutely.
work that out so that we get back to them in the next newsletter then would make sure that what we're encouraging people to take advantage of would be available to them in a timely fashion. And we'd also want to be targeting, again, those communities that are in greatest need. Okay, next.
Do you have any advice about when to open bricks and mortar churches to community groups, renters, and nursery schools?
I'm going to begin, and I'll ask Jim to step in. The governor's order and roadmap and the county executive orders look specifically at the church space and the area that is at minimal risk and could have individuals. As far as the meeting size, I don't think that we're moving to that space. There's still a size limit, I believe, on that, but I would have to confirm the space configuration is just for worshiping. There hasn't been any specific guidance that I'm aware of regarding meetings, and so I would need to follow up and get more information and share with Reverend Caseman so that he can publish that information in the newsletter.
Thank you.
Thank you. Casey, Joe is waiting to open it to those who have raised their hands. So although we still have several questions in the chat box, since we have 15 minutes left, yeah. Go ahead, Joe.
All right, I'm going to mute June. 1 second.
Thank you. June Aiken from Warner Memorial Presbyterian Church, and specifically I'm concerned about the 12-step groups. We host a number of 12-step groups in our church, and we were, before the executive order came out, we were considering inviting them to come back, but using social distancing guidelines, wearing masks, disinfecting their hands, all of the health guidelines. But then I see there's 200 square feet, right? You know, is that for every room in the church or only the religious ceremony space?
So Jim, I'm going to defer to you on that, but I think it's consistent with the entire facility. If your groups could be held in the facility and it meets the guidelines set forth in the executive order, then that would be something that you would work collaboratively with the individuals in that building, I would say. Jim?
Yeah, I can speak from experience on this. I'm at the church I attend. I am the ministry leader for a step group. And right now we are having those meetings virtually using Zoom because our is not yet opened up for smaller groups to meet. So I don't know, and I would have to look into this. I'll find out for sure. I don't know if the 200 square foot rule applies to a group of 10 or 20 people that are gathering for a meeting, or if it's just maintaining 6 feet between people in that scenario. But I will get clarification on that. We'll include that in the communication that goes out after this, and include it in the FAQs also. Thank you for asking that, though.
All right, I'm gonna unmute Sultan now, and if you do have a question, just raise your hand in the Zoom call, and I'll be able to unmute you following.
Well, actually, I was making a comment. I see that there's a lot of excitement for all the faith communities to go back, but at the same token, I want to emphasize on the need to remain safe, because the states that opened up the infection rate is going pretty quickly high. So just want to emphasize that point. I think all the guidance is given to stop this infection. So anything we can do in a cooperative manner, I think will be very helpful.
I think that's an excellent point. And a lot of people I know are wondering why Montgomery County is not moving forward as quickly as other counties within Maryland. But, and correct me if I'm wrong, Dr. Bridgers, but I believe approximately 50% of all of the cases in Montgomery, or in the state of Maryland, are in Montgomery County and Prince George's County.
That's correct.
And we have been working, as Dr. Rogers noted earlier, we're working closely with our partners in the National Capital Region to make sure that we're all moving at a similar pace. Because we do have the highest concentration, population concentration within this area. And we want to avoid the spikes that other parts of the country are experiencing. I think Florida, for one, is experiencing a sudden spike in cases since they reopened. So we are proceeding cautiously, but for the purpose of minimizing the spread of the virus.
Sure, and Sultan and Jim, you make great points from a public health perspective as far as the monitoring and the surveillance that we do, the epidemiological profile that we work through to contain the spread of the virus, to identify individuals through contact tracing. I think one of the questions early on was concerning contact tracing. We've been working with the Maryland Department of Health to contact trace 1,000 cases within the 24-hour notification. We are in the process of ramping up the number of contact tracers that we have in the Health and Human Services, Public Health Services branch to identify those individuals, to isolate them from the community, and to stop the spread. Mr. Ken Hartman made a great point when the question was raised about enforcement. The goal is to enforce through education and repetition. Many of the questions have been discussed, focused, or have centered on spacing and location and the congregants and the numbers. So just imagine how much education, once we leave this town hall forum, that is needed to reinforce, re-inform, re-advise individuals of all of the information that we've shared this afternoon. Reverend Caseman is going to present most of that in the upcoming newsletters. We have information posted at the county government's website, at the Department of Health and Human Services website, at the Office of Emergency Management and Homeland Security, from an educational standpoint, because as Dr. Gales has repeatedly said, there is no playbook for managing COVID-19. There is no vaccine. We have to work tirelessly every day to make sure the public interest and its community is protected through a partnership. That's why such forums are a great opportunity and vehicle to ask questions. And some of them may be hard questions that we work through and that we follow up. There's no guarantee that we're going to be able to provide every answer on every town hall, because it is a staticky situation. I refer individuals to the World Health Organization proclamation.
By the way, those are also on our website. We have 10 minutes left. Let me encourage.
Well, I'll stop then. I could talk all evening.
Thank you, thank you. Just want to make sure that everybody's voice is heard. Any of you that have additional questions, please raise them now.
I think I wanted to unmute Ann. Did you still have a question?
Yeah, let me, thank you. Of the 50 or 60 new cases, can you tell us how many of those actually get contact tracing performed? I just wonder how we are in terms of our capacity at this point to follow up the new cases as they come.
Sure, and those cases are contacted within 24 hours of our notification in the state system. Our contact tracers respond. We have support from the Maryland Department of Health in addition to the contact tracers that we have at the Public Health Services. So as soon as we get notification through the National Epidemiologic Data Surveillance Systems, NED, our contact tracers respond, and we've been able to respond with the support from the state of Maryland and from the contact tracers that we have within 24 hours. So those cases that are noted today, by tomorrow, they are getting calls, and we are ramping up our capabilities because it is a sustainable event. As I was indicated earlier from Reverend Caseman, Jim, I believe, Prince George's County and Montgomery County comprise of 50% of the cases in the state of Maryland. I hope that answers your question.
Now I'm going to unmute Daniel.
Good evening. My question is, what is the plan if we see COVID starting to spike once again with houses of faith opening and other restrictions being loosened? If there's another spike, is there a predetermined threshold that will shut down the churches again? And if so, what is that?
Sure, our epidemiologists are monitoring that daily, Daniel. I don't have the R number or the R not number before me. I can provide it as follow-up. I know that that was asked, but as we begin to, if we see any cases, it initially is identified. We monitor those top 10 zip codes. We're able to identify spikes based on our epidemiologist and his team here. We advise the county executive, the county council, and other decision makers in the community regarding either that particular area or if there's a large outbreak. An outbreak based on our communicable disease division is one or more, and so we work with our communicable disease team to assess and analyze the outbreak to see what the needs is, to make sure that we have those safeguards in place to get folks tested, to get individuals isolated, and to stem the spread. That would be the first course of action, or the primary level. Those secondary and tertiary effects would be through the advisement of not only the state, but through consult with the county executive and county council.
Thank you.
All right, we have one last question from Sandy, and then I guess we can go to closing remarks after that.
I would like to ask if there can be some reconsideration of the rule that indoor and outdoor services have to abide by the same distancing requirements. I ask because it's our understanding that the rate of air circulation or air exchange is very different indoors than outdoors. My church has across the street 16 acres with 2 very large meadows. We could certainly have great distance spacing across the street and house a lot more, have a lot more people than just 50 or 200. Is there any way that you will agree to sort of revisit that rule?
So from a public health perspective, as you indicated, as I listen attentively, outdoors is better than indoor because of the ventilation. I would have to speak with, again, Dr. Stoddard and Gail and Jim and his team to look at that assessment. Unfortunately, I can't give you a definitive answer, but we will bring it back to the team for discussions as we've done with all of the questions regarding the policy and the guidance that we've set forth under phase 1 and phase 2.
I would like to think that, as I said at the beginning, that it'd be fair to assume that this conversation, part of the intent here was to convey to the decision makers of the unique circumstances of our faith communities that would be taken into account as they, reassess, future requirements. So with that, let me thank everyone who has spoken, especially those of you who have been patient, especially those of you that perhaps haven't had your question answered. Know that we will be reading all of these and getting back to you. Want to acknowledge Dr. Samir Jeffrey, who was one, by the way, of 3 serving on the governor's task force dealing with faith-based communities, together with Imam Faisal Khan and Rabbi Stuart Weinblatt here from Montgomery County. But it was Samir that has helped us think through some of the most critical questions and all, and has been a real colleague in developing today's program. Debbie Spielberg, a special assistant to Mark Elrich, was remaining on after he left to be able to report back to him directly of what's transpired. Ken Hartman, one of all of the, by the way, we've got 5 regional directors. All of them have helped to promote this program, and Ken in particular pulled together that fact sheet and is coordinating the work of the regional directors with our Office of Community Partnerships. Trusted Diane Vu has been on, the director of that program, and have other council members been on. Several of the county council members have been in communication with me, thanking me for doing this and saying that they might be on and want to add a quick word toward the end. If not, Jim, do you have some concluding thoughts?
No, I do. Again, I want to thank everyone for participating in this event, and I welcome the opportunity to share with all of you. But I also wanted to just mention quickly, on the county website, there is a COVID-19 data dashboard that provides a lot of information on number of cases, trends, and everything. And it's very useful information. It might be information overload, but it's at Montgomery County MD, all one word, .gov/COVID-19. And then you'll see a link at the top for the data dashboard. So if you want to see a little more about what's going on within the county as it relates to COVID-19, that's an excellent resource there that you might want to look at.
And we're maintaining an updated resource as well on our website regarding, again, the twin viruses of COVID-19 and racism. And those also include resources for worship services, for family life, mental health, and more. So let us just remind us that while we're different, we are the same. And while we are separate, we are one. Thanks to the love with which we were born that sustains us every day of our lives. So in that spirit, let us go forth, continuing to remain in touch, supporting one another through this time.
Thank you.
Thank you all.
Thank you. Thank you.